The GOP's American Health Care Act, a bill advertised as a replacement for the Affordable Care Act, has finally been published, and by the looks of it, it'll leave countless Americans, especially those with low income, at risk. If put in place, the plan would result in 14 million fewer people being covered by Medicaid by 2018. By 2026, 24 million more Americans would be uninsured than under the ACA. What the House GOP has called, quote, fiscally responsible legislation is being denounced by a long list of medical institutions, including the American Medical Association, which released a letter stating, quote, we cannot support the AHCA as drafted because of the expected decline in health insurance coverage and the potential harm it would cause to vulnerable patient populations. The GOP's proposed healthcare plan includes a provision that bases the refundable tax credit a person receives not just on income, but also age. This will directly impact low-income households, as older recipients tend to have smaller incomes. In contrast, the nation's wealthiest will actually benefit more from the system than they already do. According to a report by Mary Alice Parks of ABC News, quote, high-income earners would likely benefit most from this plan. The reason? Should the health care plan pass, tax cuts for the wealthy would be part of the package. However, activists and organizers across the U.S. aren't taking this sitting down. They're mobilizing local communities in favor of a health care policy that would benefit everyone. One of the main organizations leading the charge is Healthcare Now, which has been working since 2004 to promote a national single-payer healthcare plan. The reason activists and organizations are pushing for single-payer healthcare instead of calling for keeping the ACA is because the act was never the answer to a systemic issue. Insurance companies raked in millions under the Obama administration, and the restrictions against these insurance giants were not nearly enough. Under Obama, healthcare remained an entirely for-profit industry. If there's going to be any chance of fighting back against a nightmarish healthcare bill, then there must be collective action directed toward creating a healthcare system that doesn't put profit over people.